Hello and welcome to Gender Equality Talk Season 2, hosted by CNS. In these talks, we hear from people on the front lines striving for gender justice worldwide. Global voices demanding that progress must be on track to deliver SDG 5 gender equality by 2030. We have with us today Marevic Parcon from the Philippines. Welcome, Marevic. Pleasure to have you with us here today.
My pleasure, and thank you for this opportunity, Sumita, and thank you, CNS, for this invitation.
Lovely. So just to introduce Marevic Parcon has been a women's rights activist for over 2 decades. She has expertise in grassroots community-based training on violence against women and girls and sexual and reproductive health and rights. She's executive director at Women's Global Network for Reproductive Rights. She co-founded the Philippine Safe Abortion Advocacy Network. She's on the executive committee of the Women Human Rights Defenders International Coalition. She's on the advisory committee for the Safe Abortion Advocacy Initiative, a global South engagement. Marevic has led and co-organized national and international events on feminist legal framework, globalization, abortion rights, SRHR, among others. Amazing, Marevic. So much work you've done on SRHR, on access to safe abortion in your country, and you've led these issues. So, right now we're at the midpoint of the SDGs. I'm just, curious to know from you, in the context that you work in, and in all these issues, Philippines has so many challenges with regard to, SRHR and safe abortion access. Do you think that the world is on track to deliver on SDG 5 gender equality?
If you look at how, if you look at how the Philippines is actually pairing on the implementation of its commitments to the SDGs, and zeroing in to the country where I am at, just to put a perspective, and we can actually multiply it in magnitude later. You can actually really say that we're far from achieving the SDGs targets. And I would, for example, on HIV/AIDS issues, for example, well, all over the world, it is declining. In the Philippines, it is continually rising, increasing in terms of the number of new infections. In January of this year, we have seen new infections of 86 Filipinos aged 19 years old and below that are, diagnosed with HIV, and then almost all of them are acquired HIV through sexual contact. So in that sense, we are really far from achieving, and we are also one of the countries that has not yet implemented the comprehensive sexuality education, which is a very, very important aspect to curbing HIV and AIDS, and also ensuring that early and forced marriages are not continually being practiced. And we are also a country in Asia Pacific that has the highest number of teenage and adolescent pregnancies, which in that case, if we are to say, are we achieving the SDGs at this point, I would say there are a lot of aspects that we still have to, that we really have to make sure that we are going to address in terms of barriers, in terms of policies, in terms of systemic systemic conditions for which all of these barriers to SRHR are going to be addressed, and SRHR is going to be implemented, and it's going to be regarded and recognized as a human right. Because here, safe abortion, for example, is not yet. It's also very, very challenging. We are one of the few countries that fully criminalize abortion. And not even, within our constitution, there is that equal protection between the life of the woman and the unborn, or the pregnant person and the unborn. But in reality, in our penal code, it is criminalized in terms of what is the legal liability of someone who has an abortion or is being caught having an abortion. You can go to jail up to 6 years. Not even, not even because of saving your life. And also the doctors and nurses and health workers that are aiding you can have their license revoked for assisting an abortion. So that's the context that we are living in. And in that sense, the question really is that how's the government is doing its effort to ensure that the SDGs commitment, including SDGs 5 and 7, are addressed. So we're far from addressing this, and I cannot also say that. And we are how many months to go before the end of the SDGs. And I really wanted also to share that the women's major group, for example, which WGNRR is a member, there is already a position paper made by the women's major group with this high-level political forum ongoing right now. And we raise a lot of red flags on what's going on, and can we really, achieve without addressing systemic oppression, without addressing marginalization, and without addressing fully, the centrality of SRHR within the SDGs.
Yes, absolutely right. So 90 months to go before, we, come to the timeline that we have for the SDGs. So, yeah, great. So many things you flagged in terms of the challenges. What do you think, we should really be focusing on right now?
I think we should be very intentional. And when I say it's public, both public and private, in addressing the systemic barriers to achieving the SDGs. We have seen, and I also going to quote the Women's Major Group position paper on this, on the HLPF ongoing right now. The SDGs repeated at least 30 times the Secretary General's report on the high-level political forum, the word transform, transforming, transformative, transformation. So these are the things that we should be doing. When we say that we wanted to transform, that we wanted to, transforming, and we wanted to be transformative, and there should be transformation in the system that we are in. It is also, we should be very intentional when we say that. It requires a lot of genuine transformation. It requires a lot of dismantling the systems of oppression, dismantling, addressing authoritarian rule, also addressing inequalities and injustices, reparation, restoration, and many others, aspects that we need to ensure to be able to rebuild our systems and societies. And in this sense, if the SDGs in fact actually are the ones saying that there should be that transformative actions that has to be done in the next 90 months, then that is actually we should really be focusing on that, and we should be very intentional, and we should be very intentional in addressing the systemic barriers and addressing the root causes of all these barriers, because without addressing the root causes, this is another just one buzzwords that are ongoing and nothing else, just like the MDGs that had happened in 2010 or 2015.
Yes. So, you spoke of, sorry, excuse me, addressing the inequalities, the systemic inequalities and oppression that, has been there. And in our communities, in the communities that you work in, what are some of the things that have worked over the last, couple of years?
What worked in the last few years? What actually really worked is that, in spite of what I said about the pervasive systemic barriers, we've also seen a lot of solidarity actions. We've seen a lot of mobilizations, and we've also seen a lot of victories with regards to safe abortion rights across the world. We know, and we know that the U.S. have regressed, and this also emboldened the anti-rights, anti-gender agenda, to curtail our rights as peoples, as women in particular. But one of the things that also we have seen that strongly also appear in the past years are our sustained solidarity, our sustained movement. And it's not only just one movement, but a lot of movements that are ongoing, a lot of actions that are ongoing to be able to address all these barriers. And I think I also attribute that really to the peoples that are working on this and pushing back to the authoritarian rules that are ongoing. We've seen this across the world, how the anti-rights and anti-gender agenda are actually really, emboldened by what's happening. We've seen it in Brazil, we've seen it in India, we've seen it in the Philippines, how the strong men are actually, and even in the US, how these rules have dominated in these past few years, and how people also push back. We are not far from over in pushing back from these authoritarian rules that are ongoing, which actually curtail our rights with the anti-rights, anti-gender agenda that are ongoing. This actually really curtail repressed people's rights to, in totality, economic, social, and political well-being, and also, your bodily autonomy, which is very much integral in all these, in your in people's rights, which is what we have seen right now. And your question about what worked, this is what is ongoing. And I would also there I don't know if you've heard of this, but there is September 28th International Safe Abortion Day, and this year we are highlighting how the stories of resistance of peoples to ensuring safe abortion rights, and to ensuring that we are pushing back this anti-rights, anti-gender agenda. And we also say, like, we are unstoppable movement, and this worked. The unstoppable movement has been working in spite of many things that are ongoing.
Amazing, amazing. Solidarity, people coming together, people's movements is what works. That is really very, very inspiring to know. Yes. So, Marevic, as you know, the Women Deliver conference is happening in Kigali, Rwanda later this month, and one of the largest conferences for advancing gender equality. What are your expectations from this conference?
We are going. WGNRR is going to Kigali this weekend. We are also going to have spaces for safe abortion rights advocacy there. I am hoping really, this is, as you said, Sumita, this is one of the largest, convergence of people working on women's rights, gender equality, sexual and reproductive health and rights, and many other issues that are really for SRHR for all and human rights for all. And I would really expect more commitments, and more, not only commitments, but beyond the words are actually transformative actions to address SRHR and human rights of everyone, to also address inequalities. And Women Deliver, as it says, it is for the delivery of women's rights. So it has been instrumental as a space for ensuring that women's rights are put in the center in the conversation, and women's rights is not a siloed and a standalone issue. It is actually an intersectional topic that one has to ensure that women are being seen not as just a person that gives birth, but a woman actually comes in many, she is from diverse background, diverse sexuality, diverse also, coming from many other identities and economic background, and many others. So it has to be intersectional in our approach to gender equality. And Women Deliver would be that space to encourage that, and would be that space also to ensure that there are really, new learnings, lessons to be shared to everyone that will be there, and also connections and making the movements stronger. More importantly, it is that space where you connect with each other, where you build that solidarity to be able to continue.
Thank you so much. Excellent. So many things you've raised for us, you've flagged. Marevic, before we kind of wrap up, any other issues that you want to flag when we're talking about this whole, issue of advancing gender justice? Is there anything else that you think we've missed out on when, you would like to talk about?
Yeah. I think we've covered, but I would also say that, to be able for us to advance sexual and reproductive health and rights, we also really has to also ensure that sexual, reproductive, and gender justice, and even development justice, is also, being advanced in the agenda that we're working in, and necessarily so we've also had to ensure that there's that universality of access to healthcare, including removal of discriminatory laws and policies, like what I mentioned about the Philippines, that it is highly that abortion is highly criminalized, that CSE is not yet implemented. So this has to be addressed, and removal of these policies, and ensuring that there are policies to address inequalities, and also making sure that and we have seen this as well globally, that there is rising anti LGBTQIA plus policies, and this has to be removed as well. We've seen Uganda, how Uganda also impacted the whole of Africa and whole world when they implemented the anti LGBTQIA plus law that criminalizes altogether the same sex relationship. So I think these are the things that has to be addressed for us to be able to ensure that the SDGs targets are going to be met in the next 90 months.
Thank you so much, Marevic Parcon. It's been a pleasure talking to you.
Thank you, Sumita, and thank you, CNS, for this opportunity. Thank you so much.
You were listening to Gender Equality Talk Season 2, hosted by CNS. Today we were featuring Marevic Parcon from the Philippines, who's done path-breaking work on the issues of SRHR and access to safe abortion. Until next time, bye for now. Thank you for participating in these dialogues, for demanding progress on